Hey, it's Jordan. I'm delighted to be joined by John and Steve. You're with our Wisconsin Revolution. We need a revolution. Why not start it in Wisconsin? And there's actually some momentum here. I'm very excited to hear about this on potentially a ballot measure on universal health care right there in Wisconsin. So can you guys kind of tell us, the news on this? Because from what you've sent me, you might be able to get it on the ballot.
I don't know, John, do you want to answer that?
Yeah,
or?
sure. Well, it's there are 72 counties in Wisconsin, and we will have it on the ballot of one county because each county and each county clerk produces the ballot for each county, and Wisconsin statute allows for county boards to put advisory referendums on the ballot for each county. And due to time constraints and when we started working on this, for this November, we're only going to be able to have it for one county. And it's the county that we chose to start in is the county where I live in Dunn County. And it's significant for many reasons. From the best of our knowledge, it's the first time that an advisory referendum asking voters about a national health insurance program. I think it's the first time that it's been on a ballot in Wisconsin. And also Dunn County is a rural county. It's a county that votes conservative often. And so the county board reflects that. But what we're trying to do is kind of change the conversation around the issue so that it's not political. And that's why county boards are nonpartisan in Wisconsin, and we tried to figure out a way to present it to people who are, surrounding this issue that affects everyone. And we got it introduced, and kind of surprisingly, even to us, it passed the committee and the full county board unanimously to put it on the ballot for the voters in November.
And the ballot question would basically be, do you approve of a national health care system?
Steve, you want to read the language?
Yeah, I was part of the committee that put this together, and we talked about a number of different phrases that have been used in the past, in particular by left-leaning people: single payer, Medicare for all, universal health care. And we concluded that they were not only not maybe precise in what we were talking about, but that had become so politically polarized that they could become an impediment to getting this passed. So here's what we came up with that will appear on the ballot in Dunn County. Shall Congress and the President of the United States enact into law the creation of a publicly financed, nonprofit, national health insurance program that will fully cover medical care costs for all Americans? And we think that that, at least in part, was what gave us the unanimous decision in Dunn County to put it on the ballot. And we're just, frankly, we're all stunned we got a unanimous vote. Wow. And we think maybe we're onto something about how to talk to regular people in a nonpartisan manner about an issue that matters to them, their neighbors, their families, and to kind of cut through the political polarization in the country and get down to a genuine, bread and butter kitchen table issue.
Right. And in a rural area, sounds like it's probably more conservative. So the fact that at least it passed this nonpartisan board, if framed in this way, could potentially even get popular support among more conservative voters.
Yeah, that's right. And I've been on the county board here for 4 years prior to me joining our Wisconsin Revolution. And the reason I thought that this might work was because I've had great conversations with people on that board, and we don't talk about what political affiliation we are. And I saw a lot of people, because in Wisconsin, it's state statute mandates that each county balances their budget each year. So the budget is pretty much the main thing that the county board deals with how to allocate taxpayer money to plow the roads and deliver the services that people need. And every month in Dunn County, just one of 72, a relatively small county, they spend on average for health insurance for their employees anywhere between $390,000 to $600,000 a month. This is just in Dunn County. And so I have seen people on the board who run the spectrum politically, I'm sure, look at those numbers every month. And then at the end of the year, they're crunching the budget for a few $100s here and a few $100s there and having to cut services and cut jobs. And just to come at it from that angle to say, can you imagine what a national health insurance program would do to local bodies of government financially if they could free up all those funds for all sorts of other things? And that, turns on light bulbs in people's heads. And, you combine that with a lot of public comment from friends and neighbors of people on the board with those healthcare stories that we all have and that we've all heard. And also remind them that we're not asking Dunn County to fix our national health insurance problems. We're just asking them to put it on the ballot so that the citizens and their neighbors can start to have that conversation between now and November. And it's, put forth by the most local body of government, which is usually the most responsive. And it seemed to work.
And is the goal, let's say you get it passed on this ballot measure, which is basically just the message of support for it, is the goal then to get it on the ballot in more counties and then possibly shift to a ballot measure for actual single payer in Wisconsin?
Steve?
I would say yes and no. We want to get this on the ballot in other counties going forward through the spring elections. Next April in Wisconsin, we have the spring elections. And there's a pretty big turnout because there will be a state Supreme Court seat on the ballot. So we expect a lot of voters to come out for that. And then we will get a bead on the 2024 elections and try to expand our reach. But no, I wouldn't say that what we're trying to do is get single payer in Wisconsin. Okay. Because the ballot question language talks about a national health insurance program. We're actually hoping maybe this will catch fire in other states. A poll is one thing. There's all kinds of polls out there about who supports Medicare for all. But then if you tell them well, that means the end of private insurance, maybe they don't support it so much. Polls can be deceiving, I think, as we've all learned over the last couple of election cycles. But if we put a very simple question to the voters without phrases, frankly, like single payer or Medicare for all, or even universal health care, if we describe it exactly as what it is and what we're calling for, we think we found out in Dunn County, even in a maybe slightly leaning conservative county, rural Wisconsin, that people approve of this. And we're going to run the best campaign we can in Dunn County, 45,000 people, west central Wisconsin, to try to get our numbers as high as we can, to demonstrate to people elsewhere that if we can cut through our politics, not worry about party politics, talk directly to what people need in their everyday lives. In some areas, we have more in common, obviously, than we have differences. The American healthcare system is barbaric. It puts people into bankruptcy. It lets people die from deferring care. It's just an out of control, overly costly system, and kind of everybody knows it. And I think that's how we got this unanimous vote in Dunn County. And we think that we're onto something and we can get it elsewhere.
And I think it's, go ahead.
I was just going to say, if someone asks like you did, what is the goal? I say the goal is to just change the conversation. And Steve said to hope that catches fire. And I use the fire department example, and I would like to change this issue from a partisan thing to an issue like you discussed the fire department. You know, if you're left or right and you talk to somebody about the fire department, they say, okay, we need that. How are we going to pay for it? How are we going to make it happen? And so if we can push this conversation forward so that all across Wisconsin, across the country, this is how people deal with it, no matter what political sign they have in their yard. This is how they start to think about the issue. Then they will demand of their lawmakers at the federal level, like, let's get this done. Obviously, the capacity for this government to do it is there. So why aren't we doing it? You know?
Well, I also think, I think Bernie attempted to do this nationally. If he could also make the argument, which I think most people respond to, of how wasteful the current system is and how universal system would save municipalities, local governments a lot of money.
School board.
Yeah, that could be appealing to any type of voter, whatever your ideology is.
That's right. That's a big part of it.
And can you kind of talk about Wisconsin in particular? Biden, I believe, only won Wisconsin by 20,000 votes. It's really become, a major swing state, obviously, over the last few years. It's got a Democratic governor, but, Republican legislature. I would think, the media has framed it like, oh, these swing states and Midwestern voters, they don't want socialism and all those things. I know you're trying to take it away from the partisan lens, but I don't know. I've traveled the country. I've been to Wisconsin, Michigan, Ohio. Most of the voters I know, these policies are pretty popular outside of just polls. I mean, just talking to people, they're for most of these things. Is that what you've seen in your conversations locally in Wisconsin?
Yes, definitely. Yeah. I ran for state assembly a couple of years ago. And that's largely what I found. And what the polls reflect about issues like healthcare, legalizing marijuana, and many others, the majority of the people are in favor of those things. And then you can dissect the reasons that the legislature is made up how it is, with the maps and with the way things are done. But yeah, I don't feel like it's a daunting task to we have to change people's minds or convince people. It's just, it's how you frame it and how you show people that first and foremost, we're neighbors and we're all going to be here together, and we don't need to agree on everything to have a much better system and a much better state and country.
Right.
Yeah, I'll tell you what, I live in far northern Wisconsin, about 90 miles north of John. I'm about 65 miles south of Duluth, Superior, up on the Big Lake. And so this is conservative redneck country up here. I can go into any redneck bar up here, and I have, because I like to have a beer every now and then. And if you get into casual conversation with people, and sometimes I'll steer it that way, I can talk to anybody about how nobody should go bankrupt in America because they got sick. Everybody up here sees on a regular basis in any tavern, coffee shop, restaurant, there's always a benefit to raise money for somebody who is uninsured, underinsured. It's a testament to how good people are fundamentally that they'll come together and try to raise that money to pay off those medical bills. But everybody knows it's never enough. If you go in with your ball cap on, without any pretensions, and talk about, again, pardon the cliche, kitchen table issues, and say stuff like that, everybody agrees with you. The Democratic Party, if they wanted to, could message like this and carry the day on this issue. And they won't. That's part of the problem. They won't, because they're beholden to big pharma, the health insurance lobby, maybe the AMA and the American Hospital Association. So I think all we've got left is to go local with the means that are available to us, have the conversations we know how to have in a plain and simple way. And maybe this can bubble up from the bottom.
Right.
Yeah, it was notable in the deliberations when it passed the committee, and in conversation afterward at the county board with board members and members of the public, but board members specifically. Nobody had the argument. The debate was basically, is this under the purview of the county? Will this make a difference? Why are we talking about this when we have so many county issues to discuss? But nobody, not one single person said, I think the system we have is great. And I don't think we should have this discussion. I think that every single person, when they brought up what they were about to say, even if they weren't initially in favor of it, they gave the caveat at the beginning, yeah, this system is horrible and it needs to change. Everybody who spoke.
So this is on the ballot now for November in Dunn County.
Yes.
Gotcha.
Correct.
Great. All right. We'll have to keep in touch, see how it goes. And if you're victorious, maybe there's momentum past that. So thank you guys for filling me in.
Will you have us back if we win it big?
We sure will.
Alrighty. Thanks, Jordan.
All right. Take care. Thanks for watching, and make sure to tune in to Status Coup's daily live stream Monday through Thursday at 5 o'clock Eastern Time and Fridays at 4 o'clock Eastern Time.